Hello and welcome to this short presentation on frostbite. This is Dr. Ignacio Scholl and we're going to talk about frostbite. This picture shows a photo of a Sherpa who is suffering from frostbite around his faces. A picture of a frostbite, typically in the early stages around the extremities and the toes. You can clearly see the brownish discoloration on the nails and the hallux, uh, that is the big toe, as well as mild discoloration on the third finger. So you see that this is the later stage of frostbite, so we gangrenous fingers. So let's get into the topic of frostbite. So, frostbite occurs usually in cold regions. It represents the direct freezing of body tissues and usually affects the extremities. In particular, the fingers, toes, ears, and face are affected. What are the risk factors for frostbite? They are smoking, peripheral muscular disease because the blood vessels are already occluded in peripheral muscular disease due to diabetes, or it can be Burgers disease, or many other due to atherosclerosis. So the frostbite can easily affect the limbs, dehydration, and alcohol consumption. So the clinical features are the tissue may be anesthetized and lose all its sensation before freezing and may go unrecognized. So the limbs are freezing, suffering from frostbite, but the person does not know it. Initially, the limbs become pale and doughy to the touch, and they are insensitive to pain, as I already told you. The tissue become hard once they are frozen. So how do you manage a case of frostbite? It is actually simple, but the rewarming should not occur until it can be achieved rapidly in a water bath because rewarming and freezing can actually cause more damage. Oxygen and 300 mg of aspirin is given stat. Rewarming of the frostbitten extremities in warm water at 37 degrees Celsius to 39 degrees Celsius is done. Antiseptic is added to the warm water. Adequate analgesia is necessary during rewarming phase because this is painful. This can be achieved by NSAIDs or even opioids. Vasodilators like pentoxifylline should be used. Once the limb has thawed, it should be dressed and rested. And refreezing should not be done. The person should not be allowed to go to the colder temperatures again. And the wound should be carefully debrided. And amputation should be only done after 60 to 90 days if recovery does not occur, because in many cases, good recovery occurs after extended period. Thank you. It's been Ignacio Scholl. Please